As a practicing surgeon and critical care physician, I felt I needed a lot more background and knowledge in business and economics and finance and in strategy. And in looking around for filling those gaps, I found that the University of St. Thomas program offered that and more, and that would help me make improvements in my own organization. I wanted to do more in terms of leadership and clinical practice to make overall improvements, to find ways to make patient-centered care more in line with the triple aim and our organizational mission and goals. So in doing that, I wanted more of an organizational role and more of a leadership role, yes. The skill sets that I obtained from the program directly set me up for leadership, a leadership position, 2 leadership positions within the hospital and the organization, both head of surgery as well as a quality and safety medical directorship. Well, certainly the trip to Washington, D.C., the exposure to Senator Durenberger, the exposure to all the Washington folks at Medicare, AHRQ director, many of the prominent politicians and leaders in Washington that help make healthcare reform decisions and decisions that affect us all nationally, those were pivotal in the education. Well, at Regents Hospital, we were very fortunate to have a very robust safety program. This caught the attention of the Secretary of Health and Human Services, Kathleen Sebelius, and her Partnership for Patients program. As such, she made a visit with her staff and spent some time looking at our safety measures in the operating room, and specifically a towel, a timeout towel, which is a physical barrier that we use to prevent an operation from starting. This was something that she was very interested in and hopes will catch on elsewhere. Because of my experience in Washington, my hospital chose me to represent us with her visit. They knew that I had met the secretary once before and thought that I would be the most appropriate person to give her a tour of the operating room and demonstrate some of our safety initiatives at the hospital. I was most concerned when I first started about the time balance, how I would balance the time it took to do the program with my clinical practice and other duties at work, call schedule, overnight, those sorts of things. It has all worked out better, way better than expected. You learn to balance the two pretty well. You learn to leverage weekend time or evening time, sometimes early mornings, those sorts of things. And you find out that everybody's in the same boat. And there are times when people have busy times in their career or their jobs, and so people make pretty good accommodations for each other, and it actually works out very well. The combination of the online and on-campus model was perfect for my setup because I can't afford to take too many days off of work to be on campus. I can fit in the online discussion stuff just about any time of the day or night, but removing myself from the hospital and the organization for multiple days in a row would have been difficult. So this model worked out absolutely perfectly for me. I think the on-campus time is crucial, not only for interaction with the professors and getting a jump start on the subject matter and the topic and discussions of the cases and the articles and the books, but networking and getting to know the cohort, establishing groups, and making the appropriate contacts so that the next 10 weeks you know who you're discussing topics and papers with online. You can put a face to a name and you know where people work and where they're coming from. I would say I have absolutely no regrets, and many, many, many pleasant surprises have come from this for me. I came from being, a good rank and file surgeon and physician to having that plus the knowledge to make a huge difference in patient care and in efficiencies and the knowledge base just in the overall national platform and healthcare reform and healthcare finance puts me in a position that benefits the organization and thus our patients. I think having the cohort of colleagues is invaluable going forward. We've all not only just become friends, but it's helpful to have networks and contacts at various organizations. There are folks within our cohort who have since gotten promotions or moved to organizations that cohort colleagues are at. Even at Regions and at HealthPartners, I know all of the folks who've gone through the University of St. Thomas program. We kind of have an alumni at Regions and HealthPartners, and that's very helpful, I think, in terms of knowing people even within the organization. But certainly networking across the region and even out of state is exceedingly helpful.